Have you ever felt overwhelmed by the endless appointments and tests that come with getting older? Maybe you're like many seniors who dutifully go to every checkup, hoping it will keep you healthy, but sometimes it just adds stress and confusion. What if I told you that some of these routine health screenings after age 70 might do more harm than good? It's surprising, but it's true. Many well-meaning doctors order tests that aren't always necessary, leading to worry, unnecessary procedures, or even side effects. In today's video, we'll explore 5 common health checkups that seniors should think twice about before agreeing to. Stick around because at the end, I'll share simple tips to help you take control of your health decisions, so you can focus on living well, not just checking boxes. Let's walk this journey together with calm and confidence. If you are not subscribed, subscribe and activate the notification bell so you don't miss any videos. If you like the topic of this video, please comment 1. If you don't, please comment 0 to let me know how I can improve and make better videos for you. Now, let's begin. 1. Routine full body scans, CT, MRI, PET, without specific symptoms. Have you ever found yourself sitting in a waiting room, thumbing nervously through an old magazine, wondering if you're doing enough to stay on top of your health? Maybe you've heard from a friend or seen on TV that catching things early is the secret to living a longer life. These days, it feels like everyone knows someone who gets routine full-body scans, CTs, MRIs, PET scans, even when they're not feeling sick. You might even feel a bit of pressure. Should I get one too? Isn't it better to be safe than sorry? After all, nobody wants to miss something serious, especially as we age. It's easy to see why so many older adults in America start to believe that getting a full body scan every year is just another smart step, like taking your vitamins or getting your flu shot. The world has taught us that technology can see everything, that we're only as healthy as our latest scan. On the surface, this idea seems comforting. If we look hard enough, maybe we can spot problems before they start. But what if that isn't always true? What if more tests don't always mean more health or peace of mind? Let's pause for a moment and turn that logic on its head. What if I told you that these routine full-body scans, done without any symptoms, just for peace of mind, could do more harm than good? Would you be surprised? Most people assume that more information is always better, that early detection is the golden key to health and longevity. But the truth is, medical science tells a much more nuanced story, one that many people, even doctors, are only starting to appreciate. Here's what's happening. CT scans, MRIs, and PET scans are incredibly powerful medical tools. They save lives every day by helping doctors diagnose serious problems, when those problems exist, or when someone has clear symptoms pointing to a specific issue. For example, if you suddenly develop severe headaches, unexplained weight loss, or chest pain, your doctor might order a scan to figure out what's going on. In those cases, the benefits far outweigh the risks. But when it comes to full-body scans for people with no symptoms, just as a checkup or to be thorough, the evidence says something different. Major medical organizations, including the U.S. Preventive Services Task Force and the American College of Radiology, do not recommend routine whole-body scans for healthy adults. Why? Let's break it down in everyday language. First, these scans aren't as perfect as they seem. Full-body scans are like taking thousands of photographs inside your body, and with so many pictures, you're bound to see a few odd spots. These could be tiny cysts, old injuries, or harmless lumps that you've had for years and never noticed. Most of the time, these findings mean nothing. But once they show up, it's hard not to worry. You, your family, and even your doctor may start to stress. What if it's something serious? Suddenly, you're swept into a whirlwind of more tests. Maybe a biopsy, maybe even a minor surgery, all to investigate something that was never going to harm you in the first place. This chain reaction is called a cascade of care, and it's surprisingly common. One harmless finding leads to another, and before you know it, you've had weeks of anxiety, invasive procedures, or even complications from treatments you never needed. In medical terms, these are called false positives. Studies show that up to 30% of older adults who get routine scans end up with these kinds of unnecessary follow-ups. That's a lot of stress, expense, and potential harm for very little benefit. Then there's the issue of radiation. CT and PET scans, in particular, expose your body to much more radiation than a regular X-ray. Over time, repeated exposure, especially if you're having yearly or biannual scans, can slightly increase your risk of cancer, not decrease it. MRI scans use magnets and don't have this risk, but they're not immune to the problem of false alarms and overdiagnosis. What's more, studies have looked carefully at whether people who get these peace of mind scans live longer, healthier lives. The answer, time and again, is no. Several large studies show that people who skip routine whole-body scans, unless there's a clear reason, do just as well, if not better, than those who get them. They spend less time worrying, have fewer unnecessary surgeries, and enjoy a better quality of life. So, what should you do if you're over 65 and wondering how to keep tabs on your health without falling into this trap? The answer is both reassuring and practical. Focus on proven, gentle, and evidence-based ways to monitor your health. Here are some simple steps you can take today. See your primary care doctor regularly. Annual checkups matter. Your doctor will review your history, listen to your concerns, check your blood pressure, and order blood work if needed. These basic measures catch most serious problems early enough, without causing unnecessary panic. Pay attention to your body. If you notice new, persistent symptoms, like unexplained weight loss, ongoing pain, unusual lumps, or changes in appetite, don't ignore them. That's when imaging tests can be life-saving. But for most folks, no news is truly good news. Ask questions before any test. If a doctor suggests a scan, ask, what are we looking for? How will this test help my care? What are the risks if we find something unexpected? A good doctor will walk you through the pros and cons. Avoid scan clinics that advertise directly to consumers. These businesses often market full body scans as a way to prevent everything. The truth is, no test can guarantee that. Stick with doctors who know your history and care about you as a whole person. To bring this advice to life, let me share a story about Mr. Thompson, a retired postal worker from Ohio. At 68, he felt perfectly healthy, walking daily, gardening, and enjoying his grandkids. But after a neighbor was diagnosed with cancer, he started to worry, what if I'm next? A friend suggested a full-body scan clinic that promised total peace of mind. After some hesitation, Mr. Thompson went for the scan, paying out of pocket. A week later, the clinic called, "We found something on your liver. You need more tests." What followed were months of worry, 2 more scans, and a painful needle biopsy. In the end, the spot was just a harmless cyst, something many people have and never know about. But the process took a toll. Sleepless nights, expensive bills, and anxiety that stole the joy from his summer. Eventually, Mr. Thompson talked it over with his regular doctor, who explained that these kinds of findings are common and usually meaningless. If you're feeling well, living healthy, and getting regular checkups, that's the best medicine, his doctor said. No scan can replace that. Mr. Thompson now spends his mornings walking in the park, not sitting in waiting rooms, and feels a new sense of peace, knowing he's doing enough. So if you're watching this and feeling that quiet anxiety, the urge to do more just in case, remember, true health isn't about chasing every shadow on a scan. It's about living well, listening to your body, and trusting the simple, steady steps that keep you strong. You deserve a life full of joy, not worry. Let science and your common sense guide you, not fear. And if you ever have doubts, reach out to a doctor who will listen and help you make the right choice for you. NOT for the machine, not for the ads, but for the wonderful person you are. 2. Prostate cancer screening, PSA test for men over 70. If you are still watching this video and find these lessons useful, please comment 1 below to let me know that you are still here with me. Let's start with a familiar moment that many men over 70 know all too well. You're at your annual checkup, feeling pretty good, maybe even proud that you've made it this far with your health more or less intact. The nurse checks your blood pressure, chats with you about your medications, and then the doctor sits down with your chart. Almost as if by routine, the topic of prostate health comes up. You hear about the PSA test, short for prostate-specific antigen, and suddenly, the conversation gets heavier. Should I get the PSA test this year, doc? You ask. Maybe your buddy from church swears by it, or your son urges you to get everything checked out. Maybe you've read online about the dangers of prostate cancer and how early detection saves lives. In America, where prevention is king, skipping a test can feel like a gamble. It's such a common situation that many older men hardly question it. Year after year, the PSA test becomes part of the routine, almost as automatic as the flu shot. After all, isn't catching cancer early always a good thing? For years, we've been told that more screening means more protection, more years with our grandkids, more time to travel or tinker in the garage. But what if that isn't always true, especially after age 70? What if the PSA test, long seen as a safety net, isn't always the right call for every older man? Let's flip the question on its head for a moment. Is it possible that for men over 70, routine PSA screening could lead to more harm than good? Could knowing more actually make your life harder, not easier? That idea might sound strange, maybe even unsettling. But it's a conversation more and more doctors are having with their patients, because the science around prostate cancer, aging, and screening is not as straightforward as we once believed. To understand why, let's walk through what the PSA test does. The test measures the amount of a protein, called prostate-specific antigen, in your blood. High levels might mean prostate cancer, but they could also mean other common, non-cancerous problems like an enlarged prostate or even a simple infection. In other words, the PSA test is not a crystal ball. It can't tell you for certain if you have cancer, or if the cancer is aggressive enough to need treatment. For men in their 50s or 60s, especially those with risk factors like a family history, the benefits of early detection may outweigh the risks. If a cancer is caught early and is aggressive, treatment could extend life and improve quality of life. But for men over 70, the picture changes. Why? Because prostate cancer grows very slowly in most older men, and studies show that you're far more likely to live a full life and pass away from something else before prostate cancer ever causes you trouble. Here's what the research says. After 70, routine PSA screening often finds small, slow-growing cancers that would never cause symptoms or shorten your life. These incidental cancers can set off a domino effect. More blood tests, biopsies, anxiety, sometimes surgery or radiation, all of which come with real risks. Infection, incontinence, sexual side effects, and a drop in quality of life. Many men go through months, even years, of stress, all for a cancer that would never have bothered them in the first place. Major medical organizations like the U.S. Preventive Services Task Force and the American Urological Association now advise that for most men over 70, especially those in average health, routine PSA screening is not recommended. The reason isn't because doctors don't care about prostate cancer. It's because, after a certain age, the risks of the test and its consequences often outweigh the benefits. For many older men, not knowing is a form of protection. Protection from unnecessary worry, from painful procedures, and from treatments that won't make you live longer or better. So, what should you do if you're a man over 70, or you love someone who is? What's the right way to look after your health without falling into the trap of over-testing? The answer is both practical and empowering. Focus on what truly matters to your health and well-being. Here are some gentle, effective steps you can take. Have an honest conversation with your doctor. Instead of automatically checking the box for a PSA test, ask, "What's the real benefit for me, given my age and health? A good doctor will talk with you about your personal history, life expectancy, and what's most important to you. Listen to your body. Pay attention to new or concerning urinary symptoms, trouble urinating, pain, blood in your urine, or difficulty emptying your bladder. These are the signs that warrant attention and could need further testing, regardless of age. Consider your values. Some men would rather know everything, even if it means more tests, while others value peace of mind and living life without the shadow of constant health worries. There's no one-size-fits-all answer. Make sure your doctor listens to what you want. Don't let fear drive decisions. The cancer word is scary, but not every cancer is life-threatening, especially for men in their 70s and 80s. Most men with prostate cancer after 70 die with it, not from it. Maintain healthy habits. Staying active, eating well, managing chronic conditions, and maintaining social connections do more to add years and joy to your life than any single screening test. Let me bring this advice to life with a true-to-life story. Meet Mr. Bernard Wilson, a 75-year-old Navy veteran from Michigan. Every year, Bernard got his PSA checked at his annual exam. He never had symptoms, but the numbers bounced around a little. Sometimes high, sometimes low. One year, his doctor recommended a biopsy after a mild elevation. The test was uncomfortable and led to a week in the hospital with a severe infection. The pathology report found a slow-growing, non-aggressive cancer. Bernard faced months of anxiety, follow-up scans, and conversations about surgery. After all that stress, the specialist finally said, "Bernard, at your age, this cancer will likely never cause problems. We recommend just watching it, not treating it." Bernard looked back and wondered if all that worry and trouble had been necessary. His story isn't rare. Thousands of older American men go through the same journey, only to learn that the best choice is not to know, or at least, not to chase after every blip on a lab report. Bernard decided that from now on, he'd focus on the life he loved. Fishing with his grandkids, gardening with his wife, and staying connected with friends at the VFW. "I realized," he said, "that health isn't just about tests, it's about how you feel and what you do with your time." If you're in the same boat, let Bernard's story be a gentle reminder. You have a right to peace, dignity, and to make health decisions that fit your life, not just your lab numbers. Screening is not a badge of courage or proof of love for your family. It's a tool, and like any tool, it has its place. Sometimes, the bravest choice is to say, enough, to trust your body and your lived experience, and to savor the years you've worked so hard for. So, the next time someone says, "Don't you want that PSA test, just to be sure?" remember, you're not being careless by asking questions or even saying no. You're being wise. You're putting quality of life ahead of the endless chase for what-ifs. Stay informed, stay empowered, and live every day with intention and joy. That's the kind of screening that matters most. 3. Mammograms and pap smears for women over 70, with no history or symptoms. Imagine sitting in your doctor's office, feet dangling just above the floor, glancing at the cheerful health posters on the wall. Maybe you're here for your yearly checkup, a ritual you've kept for decades. The nurse smiles as she asks about your medications and how you're sleeping, and then, almost out of habit, you hear the familiar question, "Are you due for a mammogram or a pap smear this year?" You pause. It's something you've done so many times before that it feels automatic, almost like getting your hair trimmed or renewing your driver's license. For generations of American women, regular mammograms and pap smears were painted as cornerstones of responsible self-care. Early detection saved lives, you were told. Good women get checked. It's easy to carry that mindset into your 70s and beyond, especially when the world around you praises staying on top of your health. There's comfort in doing what's always been done, in following the rules that helped keep you safe for so long. But maybe, quietly, you wonder, is this still necessary for me? I feel fine, you think. I have no family history of breast or cervical cancer. I'm not experiencing any strange symptoms. Is there a benefit to keeping up with these tests year after year as I move through my 70s and 80s? Let's flip the question on its head. What if continuing routine mammograms and pap smears after 70, when you have no history or symptoms, isn't helping you, but instead could be causing unnecessary stress and risk? That's not the message most of us grew up hearing, but it's one supported by a growing body of research and guidance from medical organizations. It's worth exploring, and maybe even a little freeing. Here's why. For most women, breast and cervical cancer screening is extremely valuable in the years when cancer is most likely to strike and when finding it early can truly change the course of life. Mammograms, which use X-rays to look for changes in breast tissue, and pap smears, which screen for changes in cervical cells that might lead to cancer, have saved countless lives by catching problems early in women aged 50 to 69. For women with a history of cancer or certain risk factors, such as strong family history, previous abnormal tests, or known genetic mutations, ongoing screening may still make sense even after 70. But for the majority of older women, the benefits of routine screening decline sharply as you age, while the potential for harm goes up. Why is that? First, the risk of developing aggressive new breast or cervical cancers after 70, especially if you've had normal results for many years and have no symptoms, is much lower than it is in earlier decades. For many women, these cancers, if they develop at all, tend to grow slowly, often so slowly that they would never cause trouble during their natural lifespan. The problem with continuing to screen after 70 is that it often finds something, a tiny lump on a mammogram, a small abnormal cell on a pap smear, that might never turn into real disease. Once found, these minor changes set off a cascade: more tests, sometimes painful biopsies, follow-up procedures, or even surgery. All of this can bring anxiety, physical discomfort, and sometimes complications. Studies show that for every cancer found in older women through routine screening, many more women go through needless worry and unnecessary procedures for findings that were never going to harm them. If you are still watching this video and find these lessons useful, please comment 2 below to let me know that you are still here with me. Radiation exposure from repeated mammograms, while small, adds up over time. And pap smears, which involve scraping cells from the cervix, can be uncomfortable, especially for older women with thinning or sensitive tissue. More importantly, false positives and overdiagnosis can lead to treatments that carry real risks, from infections to bleeding to long recoveries, all for something that may never have developed into a real disease. Leading medical groups, including the U.S. Preventive Services Task Force, the American Cancer Society, and the American College of Obstetricians and Gynecologists, now recommend that most women over 70 can safely stop routine mammograms and pap smears if they have no symptoms, no significant family history, and have had a decade of normal results. If you're healthy and have a life expectancy of more than 10 years, and you simply want to continue screening, talk to your doctor. But for many women, it's not only safe but wise to let go of the old habit. So, what's the best way to care for yourself as you age, without falling into the trap of unnecessary tests? The answer is more about mindfulness and self-awareness than about machines and lab slips. Here are some gentle, empowering steps. Tune in to your body. If you notice new lumps, breast changes, unusual bleeding, pelvic pain, or other persistent symptoms, see your doctor right away. Screening is for when you feel well. Symptoms always deserve attention, regardless of age. Celebrate your healthy years. If you've made it to 70 or 80 or beyond, with years of normal mammograms and pap smears, you've already done the hardest, most important work. That's a victory, and you've earned the right to step off the screening treadmill. Have an honest conversation with your healthcare provider. Ask, given my age and history, do I need to keep doing these tests? Good doctors will explain the risks and benefits honestly and help you decide based on your own values and health picture. Prioritize what truly brings health. Staying physically active, eating well, nurturing relationships, managing chronic conditions, and getting vaccines. These do more to keep you healthy and independent than any screening test after a certain age. Let go of guilt or pressure. You're not being irresponsible by choosing to stop unnecessary screening. You're being thoughtful and wise. Your value isn't measured by how many tests you endure. Let's bring this to life with the story of Evelyn, a 78-year-old retired school librarian from Pennsylvania. 4 years, Evelyn never missed a mammogram or pap smear, even though she'd had normal results every time. She did it partly out of habit, partly from worry, and partly because it's just what women do. But after her last mammogram came back with a small, uncertain finding, Evelyn spent weeks waiting, then had to undergo a painful needle biopsy. It turned out to be a harmless cyst, but the worry, the pain, and the stress made her rethink her routine. At her next visit, Evelyn asked her doctor, "Do I need to keep doing this?" Her doctor smiled and told her about the new guidelines. Together, they reviewed her health history and decided it was safe to stop. "It was such a relief," Evelyn recalls. "I felt like I was finally free to focus on living, not just testing." If you find yourself facing the same decision, remember Evelyn's story. You've spent a lifetime looking after your health. Now, it's time to enjoy it. Don't let fear or old habits keep you tethered to unnecessary screens. Instead, trust your experience, stay alert to real symptoms, and permit yourself to savor these years with confidence and joy. Screening is a tool, not a measure of your worth. The real gift is the freedom to choose what's right for you. You are more than your test results. Your years, wisdom, and well-being are proof of a life well lived, and you deserve to make decisions that honor your body and your peace of mind. 4. Colon cancer screening, colonoscopy. After 75 or with limited life expectancy. Picture this. You're sitting at your kitchen table with your morning cup of coffee, sunlight slanting through the window, mail spread out beside you. Among the letters and bills, you notice a reminder from your doctor's office. It's time to schedule your colonoscopy. Maybe you let out a sigh. After all, you've had a few in your lifetime already. Maybe you remember the days of clear liquids and uncomfortable prep, or the nervousness about what the test might show. You might even think, "I'm 76 years old. I feel fine. Do I need to keep doing this?" For many older Americans, colonoscopy screenings for colon cancer have become a normal part of preventive health care. You were told for years, catch it early and you can beat it. It's a message that's stuck with us, especially as colon cancer is one of the few cancers we can often prevent with screening. The idea of skipping a test might feel like you're taking a risk, or worse, letting your guard down. But let's pause for a moment. What if, after a certain age or health stage, routine colonoscopies don't help you live longer, or better? What if the risks and discomforts start to outweigh the benefits? It's a question that's challenging old habits and opening new conversations between older adults and their doctors across America. Let's flip the script. Is it possible that after age 75, or if you have significant health problems that limit your life expectancy, continuing to get colonoscopies could do more harm than good? That idea might surprise you, especially after a lifetime of better safe than sorry. But this isn't just a new trend. It's a conclusion backed by major medical organizations and the best scientific evidence we have today. To understand why, let's talk about what colonoscopy does and what changes as we age. Colonoscopy is an incredible tool. It allows doctors to look directly at the colon, remove precancerous polyps, and stop cancer before it starts. For adults in their 50s and 60s, or even up to 74, colonoscopy saves lives. It's one of the best examples of a screening test that can prevent cancer, not just find it. But colon cancer grows slowly, often taking 10 to 15 years for a polyp to become a problem. That means that if you're 75 or older and you've had regular, normal screenings before, your risk of developing new, aggressive colon cancer in your remaining years is quite low. And if you have other health problems, like heart disease, diabetes, or serious mobility issues that limit your life expectancy, the likelihood that a new cancer would become life-threatening for you becomes even smaller. So why do the guidelines say most people should stop routine colon cancer screening at 75? Because the risks of the procedure itself start to stack up as we age. Colonoscopies, while generally safe, are not without dangers, especially for older adults. The prep can be hard on your body, leading to dehydration or electrolyte imbalances. The sedation used during the procedure carries a greater risk as you get older. There's a small but real chance of bleeding or even a tear in the colon wall, especially if polyps are removed. Recovery can take longer, and complications, though rare, are more serious the older you are. But the biggest risk is the cascade that sometimes follows a finding on a colonoscopy. More tests, sometimes surgery, or hospital stays for issues that might never have caused you trouble. For someone with limited years ahead, due to age or health, it's not just about how long you live, but how well you live. Sometimes, pursuing every possible screening test doesn't add time. It takes away peace of mind and precious energy you could spend on things you truly love. Let's make this real with the story of Mrs. Dorothy Evans, a 79-year-old retired nurse from Iowa. Dorothy was always diligent about her health. She'd had 3 colonoscopies in her life, the last one at 72, which found nothing worrisome. But when she turned 78, her doctor suggested she could stop routine screening. Dorothy was surprised and a little anxious. "Isn't it dangerous to skip?" she asked. Her doctor explained, "Dorothy, at your age, and with your good screening history, you're far more likely to enjoy many more years without ever facing colon cancer. If you develop any new symptoms, blood in your stool, unexplained weight loss, persistent abdominal pain, we'll check it out. But another routine colonoscopy isn't likely to change your life for the better. It could expose you to risks you don't need." Dorothy admitted she was relieved, not just to avoid another round of prep, but because it gave her permission to focus on living, not testing. If you're in your late 70s, 80s, or you have serious health problems, you have a right to ask, "Does this screening still make sense for me?" And you deserve an honest answer. Here's how to approach this crossroads with confidence and peace. Talk openly with your doctor about your whole health picture, not just your age. Ask, "Based on my history and my current health, what are the real benefits and risks of colonoscopy for me now?" A thoughtful doctor will weigh your past screenings, family history, and your preferences. Listen to your body. Screening is for healthy people with no symptoms. If you notice new digestive issues, changes in your bowel habits, bleeding, or unexplained weight loss, see your doctor right away. These changes matter at any age. Consider what matters most to you. For many, quality of life, time with family, independence, enjoying hobbies, matters more than chasing every possible health risk. There's strength and wisdom in saying, "Enough," when a test is more likely to burden than benefit you. No, you're not giving up by stopping. You're honoring decades of preventive care. If you've been screened regularly and had normal results, you've already done more than enough. Now, you can use your energy and attention on things that bring you joy. If you have a shorter life expectancy due to health problems, the focus shifts from prevention to comfort, connection, and meaningful days. There's nothing careless about prioritizing your best days over more procedures. Trust the science and your experience. Guidelines from the U.S. Preventive Services Task Force, American Cancer Society, and GI societies all agree. After 75, routine colonoscopy is usually not recommended, especially with the history of normal results and no new symptoms. Let's close with some encouragement. You've worked hard to take care of yourself. You've shown up, followed through, and faced every test with courage. Now, you have a chance to step back from the cycle of endless screenings and put your focus where it belongs. Living fully, savoring family and friends, enjoying each sunrise and sunset. If a problem arises, your care team is there for you. But if not, you are free to spend these precious years with less worry and more delight. Don't let anyone make you feel guilty for listening to your own needs and the best medical wisdom. There's grace and strength in knowing when to hold on and when to let go. The final chapters of your story should be written by you, filled with meaning, not medical appointments. And that, in the end, is the true goal of all good medicine. 5. Annual EKG or cardiac stress tests in asymptomatic seniors. Think about this. You walk into your doctor's office for your annual checkup. It's become a comfortable routine, a blood pressure check, a quick chat about your medications, maybe some gentle encouragement to keep moving or eat more veggies. As you're getting ready to leave, the doctor pauses and says, "Let's get your EKG while you're here. Maybe schedule a stress test, too, just to be thorough." You nod, almost out of habit. After all, heart disease is the #1 killer in America, and the stories of friends who had silent heart attacks or sudden cardiac scares seem to grow with each passing year. It feels like you're doing the responsible thing, the safe thing. But maybe, as you roll up your sleeve for the EKG leads, you wonder, do I need this every year? I feel fine. I don't have any chest pain, no shortness of breath, no dizzy spells. My life is filled with ordinary joys. Gardening, a walk around the block, and talking on the phone with my grandchildren. Is there any real harm in another heart test, or is it just another ritual of aging? The question seems almost unthinkable, because for so long, more testing has meant more protection. Let's turn this common assumption on its head. What if, for healthy seniors with no symptoms, annual EKGs or cardiac stress tests don't make you safer, but instead open the door to unnecessary worry, extra procedures, and even risks? Could the checkups you thought would give you peace of mind do the opposite? If you are still watching this video and find these lessons useful, please comment 3 below to let me know that you are still here with me. It's an idea that surprises many older Americans, but it's one that doctors, scientists, and heart experts have been talking about for years. Here's the simple, science-backed truth. For seniors without heart symptoms or a known history of heart disease, routine annual EKGs or stress tests aren't recommended. They don't help you live longer, and they don't protect you from future heart attacks. They can sometimes lead you down a path of false alarms, risky follow-up tests, and avoidable stress. Why is that? Let's take a closer look at how these tests work. An EKG, short for electrocardiogram, measures the electrical signals of your heart. It's a powerful tool when you're having symptoms like chest pain or palpitations, or if you have a known heart condition. A cardiac stress test checks how your heart responds to exercise, or sometimes medicine, and it's invaluable when your doctor suspects blocked arteries or hidden heart trouble. But when used for routine, just-in-case screening in people who feel perfectly well, these tests often find little blips or changes that don't mean disease. As we age, our hearts pick up small scars from a lifetime of living. Tiny changes on the EKG or stress test that might be completely harmless. But once found, they can't be unseen. A slightly abnormal reading might send you off for more tests, echocardiograms, angiograms, maybe even a catheterization. Each step carries its risks: bleeding, infection, anxiety. And for many people, the treatment causes more harm than any underlying condition ever would have. This domino effect is called a cascade of care, and it's surprisingly common in American seniors. The research is clear. Large studies in the US and around the world show that in older adults with no symptoms and no history of heart problems, routine EKGs or stress tests don't lower the risk of heart attack or death. The U.S. Preventive Services Task Force, the American College of Cardiology, and the Choosing Wisely campaign all agree. If you're healthy and have no symptoms, skip the annual heart tests. They just aren't necessary, and they can set off unnecessary alarms. So what should you do if you're over 65 and want to keep your heart healthy, without getting stuck in an endless loop of tests? Here's some good news. The best way to protect your heart isn't by chasing numbers on a machine, but by living your life in a way that supports heart health every single day. Here are some gentle, effective steps you can take. Know your real risk. If you have diabetes, high blood pressure, a history of heart disease, or a strong family history, your doctor will tailor screening and care to you. But if you're healthy and feel well, celebrate that and keep focusing on the basics. Pay attention to your body. If you ever notice chest pain, shortness of breath, fainting, or severe fatigue, call your doctor right away. These are real warning signs, and that's when heart testing can save lives. Embrace heart-healthy living. Walk every day, eat plenty of fruits and vegetables, stay socially connected, and manage your blood pressure and cholesterol with your doctor's help. These habits do more for your heart than any annual test. Ask questions. If your doctor suggests an EKG or stress test, ask, "What are we looking for? How will this change my care?" A thoughtful doctor will welcome your curiosity and tailor care to what you need. Be kind to yourself. It's easy to feel guilty for saying no to a test. But wisdom isn't just about saying yes. It's knowing when enough is enough. Your peace of mind and quality of life matter, too. Let's bring this to life with a real story. Mr. George Anderson, age 81, is a retired factory supervisor from Ohio. Every year at his checkup, he'd get an EKG, even though he felt strong and had no complaints. One year, the EKG looked a little different, so his doctor ordered a stress test, which led to an angiogram. After days of worry and hours in the hospital, the final word was that George's heart was normal for his age. "All that stress for nothing," George said. "I lost a week of my life to worry and poking around. If I ever feel sick, I'll be the first to say something. But I'm not going chasing ghosts anymore." George's story isn't unique. Thousands of American seniors go through similar cycles. Healthy people made anxious by tests meant to reassure. It's a good reminder that your body, your instincts, and your lived experience matter just as much as anything a machine might say. So, as you walk out of the clinic into the sunshine, remember this. Staying healthy isn't about hunting for trouble that isn't there. It's about savoring the life you have, moving your body, connecting with loved ones, and trusting that you're doing enough. The next time someone offers you an EKG or a stress test, just to be safe, take a deep breath, ask questions, and know that you have the wisdom and the right to choose what's best for you. You've earned these years of freedom. Let your heart guide you, not just the test results. The rhythm of a life well lived is worth more than any annual printout. And your peace of mind? That's the best medicine of all. As you reflect on your health journey, remember that true well-being isn't measured by the number of tests you take, but by the life you lead and the peace you feel day to day. Many of us have grown up believing that more testing always equals better care, but modern science and years of experience now tell us a different story, especially when it comes to annual EKGs or cardiac stress tests for seniors who feel healthy. When you have no symptoms and no new risk factors, these heart tests are far more likely to bring unnecessary worry and medical hassle than to save your life. Instead of offering peace of mind, they can create a cycle of stress, more procedures, and the fear of problems that may not even exist. Your best protection comes from honest conversations with your doctor, from listening to your own body, and from maintaining the healthy habits you've built over the years. Don't be afraid to ask questions, or even to say no when a test isn't needed. Remember, being proactive about your health means making choices that add value to your days, not just filling your calendar with appointments. Cherish your energy, spend time with those you love, and focus on what brings you joy. You've earned the right to trust in your experience, your wisdom, and the scientific knowledge we have today. Keep your heart strong by living well, staying active, and nurturing the connections that truly matter. At this stage of life, the greatest gift you can give yourself is the freedom to live fully, without unnecessary tests holding you back. Your story, your health, and your happiness are worth that and so much more.